Hi guys, welcome back. My name is Nitin Arora, and as you know, I am an Indian trained sports physiotherapist, and currently I am a physiotherapy researcher in Germany. So, being a physiotherapist, I know very well how daunting it can be when a person with a particular problem comes to you with their X-ray, CT scan, MRI, and ask you, "Sir, here's my report. Could you please tell me what are the findings?" Or some person asks you, "Which clinical modality should I use in terms of should I go for an X-ray, for an MRI, or for CT scan?" And you start thinking, now what should I tell? So for that thing, you should already know what is the difference between all these modalities and how these modalities work. So this video, which we are going to talk about today, is a part of a series on imaging for physiotherapists. So today we will be talking about MRI scans, that is magnetic resonance imaging scans. So MRI scans are really very important for physiotherapists because they tell you and give you a lot of information that you cannot achieve with other modalities. So before we move forwards and actually talk about MRI scans, I would suggest you to subscribe to this channel if you have not done this till now, because we are going to bring the most deliciously crafted content for you on this channel, that is Physio Nitin Arora. So let us start. So I would be showing you certain things that you need to take care of while assessing any MRI scan. But before moving into that interpretation part of MRI scan, you should already know basics of MRI so that you can understand what you are looking at. Because what usually happens when we try to learn a new approach or technique or imaging modality, we directly jump to the interpretation part, and that's the main problem why we are not able to learn that particular thing. So to make the learning process easier for you, I am introducing you with a basics of MRI so that you know what you expect out of it, and then you start interpreting the actual slides. So for that, I would like to show you certain images, and let me share my screen. Yes. All right, so let me put myself aside on the screen, and all right, so over here on the screen, you see an MRI scanner. So those who have not seen an MRI scanner in their life, so just see, this is what you call an MRI scanner. And on this MRI scanner, you got various parts. So this is the couch on which the patient or the person will be lying down. This is the part where the couch will slide and the person goes in that MRI machine. Then this small part is the one that collects all the energy from the person's body's protons. So this thing you'll understand in the next few seconds when I'm going to talk about what energy am I talking about. So this is the usual setup. So this big machine, so this big MRI scanner is like a big magnet, It has a magnetic power more than 20,000 times of Earth's magnetic power. So it's super strong magnet. So that is why people are advised not to carry anything in MRI setups, any magnetic or metallic equipments. So though anyone having any sort of ferrous material in their body, for example, any pacemaker, any cochlear implants, any sort of vascular aneurysm implants, so they are suggested not to go inside this room because it has got a lot of magnetic strength, and it tends to pull everything that comes in the magnetic field, so it can lead to serious injuries to the people who are there. That's why people are advised not to go inside an MRI machine room if they have any metallic implant which is ferrous, which is metallic, iron based. So this is MRI scanner. Now you know. Next thing that you need to see is, so the next thing that comes into action is how does this MRI thing works? Over here, you see an MRI and a CT scan. So MRI and CT scan, how do you differentiate between the two? In CT scan, everything that is dense appears white. So for example, this head axial scan, the bone, the skull appears white on the periphery, right? And on the other hand, in this MRI, this is not as white as the CT scan. So this is how you differentiate between CT scan and MRI, that CT scans have dense bones appearing white on the scans, whereas in MRI, it is not the case. Now, how does MRI not look white on the slides? Because MRI does not work on the density of the objects in your body, the ions. It actually works on protons in your body. So how does that work? So they are small magnets. So protons are like small magnets in your body, which are randomly oriented. So some are lying here, some are lying there, and they are just randomly oriented. As soon as the person enters the MRI field, these protons are still just rotating, rotating around in the body. As soon as the person is in the machine and the magnetic field is there, the protons align in a particular direction of the magnetic field so that it is in alignment with the magnetic field of the MRI machine. Now, what happens is that although there is a magnetic field, all the protons are in a direction now. So this is, from now onwards, you need to understand the most important part of this MRI scanning, because this is where you get to understand what MRI does. So now the protons are aligned to the magnetic field. So the machine is on, the magnetic field is there, protons are aligned. Now the MRI operator will send an MRI signal over and above the magnetic field. So magnetic field is already there, the protons are already aligned, and there is now a signal that's coming. That is what we call the radio frequency signal. The radio frequency signals changes the direction of these protons further. So if these are like vertically placed now, it will be horizontally placed afterwards, after the radio frequency signal strikes the protons. Now that means there is a change in the direction of the protons, and there's a change in the rotation speed of the protons. So this change in direction and this change in rotation speed is what we call this change in direction is what we call realignment of protons, and the change in rotation speed is what we call the dephasing of protons. So the protons realign and the protons dephase. So this dephasing and realignment is the main concept that you need to remember while looking at any MRI, because that is how you interpret MRIs. So what happens now? The protons realigned to the radio frequency signal. The protons dephased means the rotation speed increased and the rotation axis changed. So dephasing happened. Now, as soon as the radio frequency signal is taken off, as soon as the radio frequency signal goes off, the protons now will come back to their original state, that is vertical. Why? Because the magnetic field is still there. So there are two things: magnetic field, radio frequency signal. Radio frequency signal comes after the magnetic field. Magnetic field led to vertical orientation of all the protons. Then the radio frequency signal led to a change in the direction, realignment of the protons, and dephasing of the protons. As soon as the radio frequency signal is taken off, the protons come back to their normal position. And as soon as the protons come back to their normal position, some protons come back to their normal position very quickly. The other ones take some more time to come back to their normal position. And this is the main concept. So this is how you generate the two types of images that you call T1 weighted images and T2 weighted images. So what happens? The protons, I told you, some protons come back to their normal alignment quickly. Those protons are what we call the fat protons. So fat particles, the protons in the fat particles come back to their normal position very quickly. So when you take a photograph, the thing that comes back quickly will appear on that photograph. Then after some time, the other protons that were in water, so those we call water protons, they take some more time to come back to their normal position. So they take some more time for rephasing. So I told you there's something called dephasing. Now there's a loss of dephasing. There's a loss of resonance. They come back to their normal position, and those are the water protons. So the fat protons come back quickly. The water protons take some more time to come back. And that is the difference between a T1 weighted and T2 weighted images. So there are two types of images. One is T1 weighted, that is the fat protons. Okay. So fat means all the fat particles in the body, the protons in those fat particles come back to their normal position very quickly. And that is why the images that you take initially on an MRI scan will show all the fat particles. So in this image on the left side, this is a T1 weighted image. T1 weighted means fat proton energy weighted image. Okay. So here you can see the subcutaneous fat. So this is a cervical spine MRI scan. You can see the subcutaneous fat. You can also see the epidural fat here, right? You can also see the bone marrow in the vertebral bodies, because that also contains fat. So everything that contains fat will be visible in a T1 weighted image, that is the fat proton energy image. Now comes the second type of image that we call the T2 weighted image. T2 weighted image means the image that comes later. So fat particles, fat protons came back to their normal position, emitted their energy. MRI machine captured that energy and showed you this first image, T1 weighted image. Then came the water, T2. So water protons took some more time to come back to their normal position, to realign back to the normal position, to dephase back to the normal position, to lose the resonance they gained in that MRI machine. So that is when we get the T2 weighted image. So that means T2 weighted image will show you everything related to water plus fat. Why? Because the fat particles that were there earlier are still emitting energy, and now the water protons are also emitting energy. So now here you'll see that in T2 weighted image on the right side of your screen, so this is T2 weighted image, and you'll see that the CSF is white, cerebrospinal fluid is white on both the sides, so that is water or fluid. Then the discs appear white. You see the disc, intervertebral disc appears white here. So these fluids start appearing white on a T2 weighted image, that is water proton energy. Okay. But also you see here that this subcutaneous fat is still white because the fat particles are still emitting energy. And that is why T2 weighted image captures the energy from fat and water, whereas T1 weighted image only captures energy from fat images, because water protons are still not emitting any energy. So T1 weighted images show you, if you want to see bone marrow, if you want to see subcutaneous fat, if you want to see spinal cord, here you can take a T1 weighted image. If you want to see intervertebral discs, if you want to see the CSF, cerebrospinal fluid, you can take a T2 weighted image. Okay, understood? So now why we emphasize on this thing so vividly, because when you read an MRI scan report, you will find a mention of T1 and T2 weighted images, and then you should not be confused of what these things actually mean. Now comes the next very important topic in this thing, and that is, so now you know that T1 weighted image is fat image, T2 weighted image is fat plus water. Okay, so these are the two types of MRI images. But the story does not end here, because you have a third type of MRI image that we call stir STIR weighted image. So STIR image stands for short tau inversion recovery images. Okay. So short tau inversion recovery image is a third type of MRI image that you usually get when things are not clear in T1 or T2 weighted image. And when can that be the case? For example, in this image, this is a T1 image. You see the bone marrow. You don't see the cerebrospinal fluid here. So bone marrow is visible, fat is visible. But here you see that there are one and two, there are two vertebral bodies, but there's some dark thing visible here, which we cannot understand what it is. We do not know, right? So if you take a T1 image, this thing is dark. You can't differentiate what this thing is. If you take a T2 image, this thing will still not be clearly visible, right? Because it still has fat and not that much of water. So now you need a third type of image that specifically focuses on fat structures and takes out all the water content from that area. So now you need a third type of image that helps you differentiate between T1. T1 was fat and T2 was water plus fat. Now you need an image that is only water. So no fat should be visible. So STIR weighted images are the images that only show you the water in the image. Okay. So no fat is visible. Only thing that you see here is water. And now you know very well that vertebral body should not have water, right? They have the bone marrow, so they should have fat. So there is some problem here. And what is the problem? So to find out that problem, you had this STIR weighted image. Now what is visible here is what we call spondylodiscitis. So this is usually not visible on T1 or T2 weighted image, and that's why you need a STIR weighted image. Now the story is still pending because you have some more types of images. So one you can see here is a FLAIR images. You don't usually see these type of images in your day-to-day physiotherapy practice because these are more related to brain MRI, but you should still know about them because if someone asks you, you should have an idea of what we are talking about. So for example, what are these FLAIR images? FLAIR is fluid attenuated inversion recovery images. So as the name implies, fluid attenuated, fluid decreased. So STIR weighted images had only fluid, so fluid enhanced images. FLAIR images are fluid attenuated, means the fluid is not visible here. For example, you take a normal scan and what you see here is that it's a T2 image. In T2 image, you know very well that all the things, this is a brain scan by the way. So all the things that are visible on a T2 scan all the fluid will appear white. Okay. Now you see it's white CSF here. This white thing is also CSF here. But we do not know what this is. It can be CSF, but usually CSF is not present here. So what is this? Now we need an image type which shows us clearly that what is this thing. So what we need to do, we need to make all the water structures black. So everything that has water or fluid in it should turn black. And whatever remains is not water. Clear? So we attenuated the fluid signals so that everything that is left behind is something that is not water. That means that's not normal at that place. That is something pathological. Maybe infection, maybe tumor, maybe this is a classical sign of multiple sclerosis, lesion, right? So this is where you need FLAIR images for MRI. Last but not the least, you have T2 gradient echo, that is the same T2 image, that is every fluid thing should appear white. But what happens when there is some blood in the brain structures? We do not know. So that gets obscured. So for those obscured blood structures, we need that those should appear differently. So we need T2 gradient echo. So just remember the name. You don't need to know about this in quite detail. Then you have diffusion weighted images. This is diffusion weighted images. And second type is apparent diffusion coefficient, ADC images. So just for your basic understanding, whatever appears very bright on a DWI, that is diffusion weighted image, and whatever appears very dull or grayish on a ADC, that is apparent diffusion coefficient image, is a lesion. So these two images are usually seen together. So you have both the things in your hand and you compare those. Okay, this is very bright. The same areas appears very low in the other scan. So that means there's a lesion here. Okay. Now, you know very well what all types of images we do have. T1 weighted, T2 weighted, stir weighted, flare images, diffusion weighted images, ADC images, and T2 weighted echo, gradient echo, right? So after these images, even sometimes what happens, even after having all these types of images, some things are not visible clearly. And in that case, you need something called a contrasting agent. So for the contrasting agent, you use something called gadolinium. Gadolinium is a substance that you put in joints or intravenously. It goes to the part which you want to scan, and then it will give you a bright image because it reflects more energy while you do the MRI scan. Okay. So on the MRI scan, for example, for this patient, this gadolinium was injected in the shoulder joint. And over here, you can see this is the scapula. This is the humerus. So this glenoid labrum of the scapula that extends on both the sides here and here. So anterior part, this is the anterior part of MRI scan. We'll talk about this in the next couple of minutes. So this anterior part of the glenoid labrum is out of place. It's not in continuity. So this is a case of recurrent shoulder dislocation where the anterior labrum went off phase. Okay, so this gadolinium enhanced image helped us see this properly. Now comes the most important part that you people were waiting for, that is the MRI interpretation. So this is an MRI of the cervical spine in front of you. And over here, the very first thing when you get an MRI slice in your hand, the very first thing that you need to see is the name of the person, right? This is a very common problem that happens, that you read the name and this is a very common problem that usually happens, that sometimes people they do not read the name, they read the MRI, and you read MRI from some other person, and then you are confused what happened. So always read the name first, then the date of birth of the person. Date of birth of the person, if you want to know the importance of date of birth, you can just watch the video that's being shown up, the link that's up there in patient assessment, because date of birth is so important that there are so many problems that appear or occur at a particular date in terms of, at a particular age. So if you know the date of birth, you know the age, you have an idea that, okay, this might be the case. So history taking goes with the date of birth here, and that might go a long way in assessment of the person. Then the hospital ID, if the person is in ICU or if the person is in ward and you want to just see the person ID and name, then this is on the left upper side. Then second thing you need to see is the image number. So every MRI scan has various slides. Okay, it will be a big piece of it will be a big thin sheet of it will be a big thin sheet with multiple slices and scans. So the image number will tell you which part of this image are you talking about. So this is what we call the scout image. This scout image tells you, okay, this is a cervical spine, the neck region that's being scanned. So it will have small horizontal lines like this. Now these lines will have a number 1, 2, 3, 4. Like now over here you'll see, okay, 4. If the image number is 4, you'll see 4 means this is somewhere near this area. So this is the area being scanned. So if you want to see the disc at this area, you need to see image number 2 and not 4. Okay. So this is how you use this image number part. Then the body part. Sometimes MRI scans are so focused and specifically focused on a particular part that you can't even recognize which body part it is. So go to a scout image or see this body part and see, is it the left side of the body, the right side of the body, or what? You do not know. So especially for the limbs, for shoulder, elbow, hand, wrist, so you need to know which part or which side of the body you are referring to. Third thing is the plane or scan type. So MRI scans can be taken in multiple planes. Sagittal plane, coronal plane, frontal plane, axial plane. We'll talk about this in a short while. And then you need to see the date and time so that you know that you are assessing the latest MRI of the person. Okay. Before I move forwards, I would like to raise a very simple question, that which type of image is this? Is it a T1 weighted image or a T2 weighted image? I will give you a hint that the cerebrospinal fluid here appears white. And here as well, it appears white. So now please write down in the comment section that which type of image is this, T1 weighted or T2 weighted. I'll await your answers, and you can check your answers in the description. I will put the answer in the description section. So second thing that you need to check is whether the image is T1 weighted or T2 weighted. Now over here, as I asked in the last slide, that which type of image was that. So as we can see that all the bone marrow structures are white, all the subcutaneous fat is white, all the epidural fat is white. So this is what we call a T1 weighted image. This comes from fat structures and it helps in looking at the anatomy of the structures very nicely. Whereas the other one is what we call a T2 weighted image, where the cerebrospinal fluid appears white and the disc appear whiter than the other one. This is a T2 weighted image. Now, the next thing that you need to see is if the person, usually what happens is people do have an X-ray before they go for CT or MRI, usually for joints, because X-rays, are relatively cheaper and are inexpensive modalities to see the joint structures in a nice way. So if you have a digital quality, nice X-ray, you can compare it with the MRI findings that you got. So on X-ray, you'll see that everything appears white, which is dense appears white. Okay. You can see the bone cortex for, let's say, this knee joint. You can see that, okay, you see this femur, you see this patella, you see tibia over here and fibula. If you want to know more about X-rays and CT scans of the knee joint, you can just click on the link given above and you'll be redirected to a video in which I discussed about all these points, that how to read X-ray and CT scan of the knee joint. Meanwhile, so here is the cortex. The cortex of the bone is clearly visible on an X-ray, but when you go for an MRI, you do not see the cortex of the bone, but rather you see the internal bone marrow structures of femur and tibia and patella. So these are bone marrow structures that are visible. Then you also see some fat and some tendon structures, but you see this grayish thing here. These are your ACL and PCL ligaments, which run from the femur to tibia on both the sides. I mean, anteriorly and posteriorly. So anterior cruciate ligament and posterior cruciate ligament. And then you have subcutaneous fat pouches above the patella and below the patella. So that helps in avoiding rubbing or friction between the patella tendon and helps in proper knee functioning. Okay. Now, last but not the least, what you need to take care of is whenever you see an X-ray or an MRI scan, you need to see that which type of image is it. Is it in the coronal plane, in the sagittal plane, in the axial plane. What does that mean? So if you want to know more about if the image is in sagittal plane or coronal plane or axial plane, just click on the link given above, in which we explain about the biomechanical planes and axis of the body. So that will help you gain 2 points: one, biomechanics; two, imaging. So simply stating, whenever you see something from the side, so you cut a person from the center and see a thing from the side, like in this image, this is what we call the sagittal plane. If you cut a person, not cut a person, cut a slice from the person's body while taking an image vertically and divided it into two parts, anterior and posterior, that is what we call a coronal or frontal image. And the third type of image is when you cut a person horizontally. So I want to see this part. So this is what you call the axial plane or transverse plane. So these are the types of planes and axes that you see in MRI. Now, what you need to take care of, that whenever you yourself, let's say you are working in a hospital setup and you want to go for an MRI or want to see someone getting an MRI, always remember, do not enter the MRI room with any sort of sharp metallic equipments, because they tend to create a parabola. Parabola, parabolic movements, it's like swing. So let's say you have a small knife, you have a scissor, you have a blade, you have some sort of clip, let's say hair clips, okay, metallic bands, hand bands, any chains, or even makeup. If you have a lot of makeup that has metallic shining substances in it, mascara, that might lead to that magnetic field pulling those structures toward it, and it will be disastrous for the people who are there in the MRI scan machine. For the operators, it will be disastrous. So always remember this thing, that you should take care of this thing. And if a person has, whenever you advise anyone going for MRI or any family member who's going for MRI, always remember that people with pacemaker, people with any sort of aneurysm clips, any sort of cochlear implants, any sort of electronic devices in the body should not be allowed in the MRI room until unless those equipments are MRI compliant. So you have two types of equipments. The ones that are MRI compliant and the other ones that are not MRI compliant. So you should take care that the equipments that the person has are MRI compliant, or else they should not be allowed to enter the MRI room, or else it will be disastrous. So always remember this thing and keep this thing in mind while suggesting anyone to go for an MRI. And some people do have something called claustrophobia, that's fear of closed spaces. MRI is something that takes 40 to 45 minutes to complete, and those 40 to 45 minutes might be very fearful for a person who is lying down in that machine, because MRI machine tend to produce a lot of sound and noises, and so people also get earplugs for that. But still, the one who's claustrophobic lying in a closed chamber will be very frightened. So you should take care of that thing, that if a person is claustrophobic, they are given certain medications, sedative medications, so that they can lie down, do not know what's happening, and relax for the next 40 minutes. And then they get up and wake up and come out. Women who are breastfeeding and women who are pregnant, especially in the first trimester, are not usually allowed in the MRI scanners because we do not know what effect that equipment might have on the growing embryo. So with these things in mind, I hope this video helped you understand the basics of MRI scanning and basics of MRI interpretation. We will be bringing more videos on this topic of MRI, CT scan, X-rays, examination, PET scans, functional MRI scans, and how to interpret those. So if you like this video, just hit the like button. If you liked it a bit more, you can consider subscribing to our channel and sharing this video with your friends whom you think this video might be useful. If you got any questions, queries, or doubts, feel free to just write down in the comment section. If you think you need some video on a particular topic of your interest, just write down in the comment section and we will be back with that particular video in the best possible way we can bring that content. So We will see you in the next videos. Thank you for watching this video till this point, and I hope you find our content meaningful and helpful. So we'll see you in the next videos. Till then, stay tuned, stay connected. Have a nice day ahead. Bye bye.